Hi, Dr. Chris Sanford here. Traveler's diarrhea. It is the scourge of international travelers. It goes by a number of colorful names, including Delhi Belly, Montezuma's Revenge, and the Rangoon Runs. Symptoms familiar to most of us who've traveled outside the wealthy nations: diarrhea, nausea, cramping, feeling crummy. It's not devastating, but it crimps your style for a few days. The cause, usually a bacterium, usually from contaminated food or water. In terms of risk avoidance, risk reduction, you can wash your hands several times a day. That's a good idea, ideally with soap and water, but also there's benefit in alcohol gels. In terms of food selection, traditional wisdom is boil it, peel it, cook it, or forget it. But actually, when studies are done on folks who get diarrhea, there's not been a lot of benefit from trying to follow safe food guidelines. However, I still think it's a good idea to follow a few basic rules. Avoid, in middle and low income countries, tap water, roadside stands, lettuce and salads, raw food, ice. Safer would be anything boiled, so boiled water for tea, coffee, rice, chicken, something dry like bread, something carbonated like a beer or a pop. But you can follow all those rules and get diarrhea anyway. In terms of treatment, no treatment is mandatory. It's usually self-resolving, but there are a couple of drugs that are options. First, of course, drink a lot of fluids and take it easy. One potential treatment drug is loperamide. It's an over-the-counter gut antimotility agent sold in the U.S. under the brand name Imodium. Now, don't take it if you have serious symptoms. So if you have blood in the stool or fever or significant abdominal pain, then you don't want to take Imodium, and you probably do want to see a doc. But if it's just ordinary diarrhea, nothing else, and especially if you have something coming up like a bus ride or a jet ride, then taking loperamide can give some benefit. Another drug is an antibiotic. Most commonly we give azithromycin. It's prescription only. Benefit, upside, usually makes the diarrhea go away a little quicker. Downside, it's an antibiotic, so it has side effects potentially. You can have an allergic reaction, you can get a vaginal yeast infection. It builds resistance, and rarely it can cause diarrhea, the very thing you're trying to prevent. So in summary, it's common, it's benign, usually goes away of its own accord. When to see a doc? Usually you don't need to, but if any of those warning signs are present, like blood in the stool or fever, you should. Or after a week or two, if it's not getting better, then seeing a doctor is a good idea. For more information, take a look at my website, drtravel.com. Safe travels.